Assalamualaikum and good day everyone. Today, my friends and I will be presenting on liquid-based cytology (LBC) with a particular focus on the Thinprep method. Cytology plays an important role in modern healthcare as it involves the examination of cells for the detection and diagnosis of various diseases. Throughout this presentation, we will discuss the principle of thin prep technology, its procedures, and the advantages it offers compared to conventional cytology method. To appreciate why LBC has become the preferred method, it's helpful to first understand the limitation of the conventional pap smear. Cervical cancer screening rely on the traditional pap smear. In this method, collected cells were manually spread onto a glass slide by a healthcare professional. Because the quality of the slide depended entirely on manual preparation, the final specimen could vary from one sample to another. The biggest challenge with this technique was that blood, mucus, and other debris could obscure abnormal cells. When these cells were hidden, they could be missed during microscopic examination, resulting in false negative results, which reduced the reliability of the screening process. To address this limitation, liquid-based cytology was introduced. Unlike the conventional smear, LBC used a standardized automated laboratory system for sample preparation. This approach produced cleaner, more uniform specimens, ultimately improving both sample quality and diagnostic accuracy. Because of these advantages, LBC has become the global standard for cervical cancer screening and is now also applied in the analysis of other body fluids.
Moving on to our main topic, which is about Thinprep. There are a few Thinprep processes, which are Thinprep 2000 and Thinprep 5000. Thinprep 2000 is a semi-automated process that prepare one specimen at a time and require considerable operator involvement. Meanwhile, Thinprep 5000 is a fully automated process capable of batch processing up to 20 specimens with automatic vial handling, barcode verifications, and up to 45 minutes of hands-free operations, making it more suitable for high-volume cytology laboratories. Let's focusing on the Thinprep 2000. Let me show you the anatomy of the Thinprep 2000s. First, waste bottle and waste tubing, where it will collect the excess perceived site fluids, mucus, blood, and debris removed during processing. Second is a specimen vial, where it contains the collected sample suspended in a methanol-based pertusite solutions, where it will act as the source of cells for slide preparations. And then put it in the vial holder, where it will hold the specimen vial and raise the vial to contact the filter during processing. Next is the filter assembly, where it consists of the Thinprep pap test filter and filter cap, where it will rotate during the processing to disperse the sample and collect cells. And then bobbins, where it will hold the filter assembly in place and allow the filter to rotate during the cell collections. Next is the slide holder, where it holds the microscope slide during the cell transfer and eject the slide into the physative bath after preparations. And lastly is the physative vials, where it contains the physative solutions and receive the prepared slide automatically after cell transfer.
Let's we continue into the principle of Thinprep liquid-based cytology. The Thinprep technique in liquid-based cytology (LBC) involve dispersing cell in liquid medium, followed by their collection on disposal polycarbonate filter via vacuum filtration. The cells are subsequently transferred and adhere into glass slide using air pressure, resulting in a standardized monolayer preparation for microscopic analysis. So, how it works? Based on the first principle, which is dispersion, we can see on the video, a disposal cylinder with an 8 micrometer polycarbonate filter is placed into the vial. The Thinprep processor uses a mechanical rotary drive. It can homogenize the cell suspensions, breaking up blood, mucus, and other debris while suspending the diagnostic cells. Next is troubleshoot of dispersion phase. We have two issues. The first issue is have a cell clumping or thick and unreadable cell patches on the slide. This is because of inadequate mechanical mixings or high mucus content. We can fix it by vortex the preserved site vial for 5 to 10 seconds before loading. For highly mucoid specimen, perform an acetic acid wash or add glacial acetic acid to break down the mucus before running the processor. The second issue is filter clogging errors or premature cycle termination. This is because of too many cell or heavy background debris. We can fix it by dilute the sample with a fresh vial of preserved site solution or run the specialized filter wash protocol to clear the excess debris.
I will proceed and briefly explain the collection phase and common troubleshooting issues. During the collection phase, a gentle vacuum draws the cell suspension through a filter. Small debris and broken red blood cells pass through the filter, while diagnostically important cells are attached to its surface. The instrument continuously monitors the cell density and flow rate. Once the cells are evenly distributed with minimal overlapping, the flow rate decreases. This helps produce a thin and uniform layer of cells for microscopic examination. Several problems may occur during the collection phase. One issue is scanty cellularity or a sparse slide. This can happen when cells remain trapped on the collection broom or brush because the device was not rinsed properly in the specimen vial. To prevent this, the collection device must be rinsed immediately after sampling and placed into a new preservative fluid without delay. Another common problem is a clogged filter or instrument error. This may be caused by highly cellular specimen or by a defective dam or reused filter. Highly dense specimen should be pre-diluted before processing. In addition, a new, dry, single-use filter must be used for every sample.
Now we will move to the transfer phase for this process. So after the cells are collected into the cylindrical tube, they will be inverted 180 degrees, and then the cells inside are gently transferred onto the glass slide. There, a slight pressure is applied to the slide during the transfer of cells to produce a 20 mm circular smear. And then lastly, the smeared slide is then placed onto a fixative path. Now we will move to the troubleshoot for the transfer phase. So first is where the vacuum mechanism of the machine becomes faulty. Usually this is due to the airflow disruption that occurs in the vacuum system that can disrupt the negative pressure in the machine. So how do we fix this? We need to clean the filter plug and suction cups. This helps to ensure that the negative air pressure responsible for cooling the cells remains stable. And the second issue is where the robotic arm of the machine are unable to grip the slide properly. Usually, this is caused by mechanical gears of the arm that are not maintained properly. If we just let this issue occur, it will cause accidents during the processing phase. So how do we fix this? We need to reset the mechanical position of the gripper and recalibrate the positioning sensors.
General clinical goal for sample collection is to collect and preserve cervical cells so they can be examined accurately in the laboratory. The collection tool that we can use is either cervical brush or spatula or broom. The medium that we use in Thinprep sample collection is preserved site solution, which is methanol-based preservative. The first step is patient identification and labeling. Before any clinical procedures, the clinician are needed to record patient details like full name or ID numbers on the vial, and it must match with the pathology request form. This is to avoid any clinical errors like missed upsample. The second step is cell collection, where we obtain an educate sample from the transformation zone of the cervix. This is where over 90% of the cervical cancer starts to grow. The way we rotate the tool depends entirely on what device we choose. If you use a plastic spatula, we rotate it 360 degrees around the ectocervix while maintaining a tight contact. If you use a brush, we insert it into the inner canal until only the bottom fibers show, and turn it just a quarter to a half turn in one direction. And remember, we never over-rotate the brush because the inner canal is highly fragile, and the tissue trauma will cause bleeding, which ruins the cell sample quality. And then, if you use a broom-like device, we push it gently and rotate it clockwise for 5 complete turns to sample both ectocervix and endocervix at the same time. The third step is sample transfer. The collection device that we used to collect the sample just now is immediately rinsed in the preserved site solution. For the spatula or brush, we swirl and rotate it vigorously 10 times against the vial wall. For the broom, we push it into the bottom 10 times to force the bristles apart. Crucially, we do not lift the device head inside the vial, and then the tool is drawn away completely. Lastly, specimen transport. We twist the cap tightly until the black taut line on the cap passes the taut line on the vial. This creates a perfect airtight seal. If it's too loose, the volatile metallic liquid will leak or evaporate during transferring, destroying our cell suspension. Once sealed, we record the patient info on a requisition form and place the vial in a specimen bed to be sent straight to the lab.
Now, I'll explain the advantages of liquid-based cytology or LBC over the conventional smear. First, LBC produces fewer unsatisfactory smears because the cells are evenly distributed in a single layer with less blood, mucus, and debris blocking the view. Second, cell preservation is better. The cells are immediately placed into a liquid preservatives, which reduce drying artifacts and cell damage. Third, LBC requires less screening time. Since the cells are cleaner and more organized, slides can be examined more efficiently. Finally, LBC has a higher detection rate, leading to a more accurate interpretation and improving the detection of abnormal and precancerous cells. These are the examples of LBC and conventional smear slides. Unlike the conventional pap smear, where almost all the collected cells are transferred directly onto a glass slide, Thinprep preserves the remaining sample in a vial containing preservative solution. This leftover sample is called the residual LBC cell suspension. One important use of the residual sample is reflex testing. Reflex testing means performing additional laboratory tests using the same specimen without asking the patient to return for another sample collection. For example, if abnormal cervical cells are detected, the remaining LBC sample can be used for high-risk HPV DNA or mRNA testing, which helps identify patients who are at greater risk of developing cervical cancer. Another advantage is cell block preparation. The residual cells can be concentrated and processed into a cell block, which is similar to a tissue biopsy. Thin sections can then be cut and stained for histological examination or immunohistochemistry, allowing pathologists to better evaluate suspicious or malignant cells. Compared with the conventional smear, this offers several advantages. There is no need to recall the patient for another sample collection, it reduces patient discomfort and saves time, it lowers healthcare costs by avoiding repeat collection, and it provides additional diagnostic information.
Now, it's time for us to move to the common screening errors that usually occurs in this process. For the first errors is where the cells show low cellularity and also scanty cells. So it is usually caused by a poor collection technique and also inadequate sampling. So in order to solve this, we need to repeat the collection using the correct technique. Next is where the fixation of the cells appear to be miscolored or poor. So it is usually caused by using expired preservative, improper storage, and also inadequate amount of transfer. So to solve this, we need to use fresh reagents and apply a proper storage conditions. Lastly is where the presence of artifacts may appear on the slide. So the causes for these errors are usually dirty instrument or filter blockage. So to solve this, we need to always service the equipment and keep the instrument well maintained.
Quality control is important throughout the procedure. During the pre-analytical phase, patient identification and specimen labeling must be verified. The correction collection device must be used and adequate sampling of the transformation zone should be confirmed. During the analytical phase, the Thinprep processor requires daily maintenance. Instrument calibration and function must be checked, and while reagent quality and expiry dates should be monitored. Finally, during the post-analytical phase, slides must be reviewed according to standard operating procedures. Slides should meet the required quality criteria, and any unsatisfactory slide should be processed. These steps ensure that the final slides are suitable for reliable screening and diagnosis. That is all from us. Thank you.